Nagaland State AIDS Control Society NSACS pra National AIDS Control Organization NSCO laga under the intensified IEC campaign 2024 August 12 the launch kribule ase NBCC Convention Center Kohima pra ido International Youth Day logode coincide krigina dui moina campaign pra public kan ge HIV or sexually transmitted infections STI kan opor jankari dibo aru itu homoy safe practices or stigma kan komti kribule koshish kribo India de manu HIV thagya dunia de sabse beshi second place te ase kushe 2023 de 25.44 lakh HIV thagya manu thagishe kude 68,450 nutun lagia kan thagishe high priority districts kundu 2007 de 156 thagishe edukan 2022 de 178 utishe intensified IEC campaign kundu state or union territory sob te launch kribo edu pra manu kange HIV aru STI kan opor thik jankari digina edu epidemic ke rukhabole kuribo NSACS pra 780 bostige pungchubole plan kuri ase aro rural aro urban jaga sobte alak alak program kan nobule set kuri gina ase
So here this is going to be a pan India event and will happen on the same day. So as I said, by way of a background, our country, India, faces a significant constant challenge in the form of the HIV/AIDS. And India has a very high number of people living with HIV. And even though the national HIV/PR, the prevalence rate is low, there are approximately 25.44 lakh people living with HIV in India. And just last, as per the official count in the of 2023, we have 68,450 new cases. So yes, and there are certain states that have shown a rising trend, including some of the states here in our northeast India, such as Arunachal Pradesh, Nagaland. Fortunately, for our state, we have been to some extent able to stabilize the epidemic, and as such, for the last 4 or 5 years, there have been low spike cases quite robust. And presently, however, we still stand at the as per our prevalence rate, we still stand that number two, only next to Gujarat. And presently, we have a prevalence rate of 1.34. So, in order to enhance the knowledge levels of awareness to our general public, this intensified campaign is going to be held, and this is going to be following the launching program. This is going to be a 2-month exercise. So this is intended to reach all little corners of our state. And the key objectives of this entire 60 days program is to, as I said, is to enhance the knowledge and understanding for the general public. Number 2 is to promote safe practices and reduce stigma. So, as you are aware, the major step that we can take towards creating awareness to our public is through this kind of awareness activities, and as is obvious, this can be achieved mainly through our media. So under IPC a lot of activities have been planned, and in detail, our concerned program officers will dwell upon the details, the activities. However, there will be broad-based two types of category based on which all these activities will be carried out. One will be rural activities and one will be urban activities. Under the rural level, we will have village level meetings and HIV awareness. Then we shall be having school outreach programs with all villages as in we have shortlisted some with 8 villages. Then we will be disseminating information on HIV, SDI through our IC materials. We shall be having interpersonal communication sessions with village health, sanitation, nutrition needs. In the category of the urban level activities, we will be having, it shall be launched through a rally. Then we will be having 5 blocks and awareness sessions in all colleges, especially through our RRC, the Red Ribbon Club academies. We shall also be having special camps at government hospitals and also sensitization programs for our ombudsman and the police officers. So, as I said, to go into the further details of this, I will now give the thanks to our Deputy Director, IEC.
Yeah, as mentioned by our Deputy Director, we will be having campaign activities at the rural as well as at the urban levels. And this rural levels is done at 780 villages in Nagaland. And this will be conducted by our field functionaries at the district, and this will be done in coordination with the district administration and village council. So, for this campaign, we will we really need the support of our district administration, including the village council, because we are going to have village level meeting on HIV and STI awareness. We will also be performing folk performances by our BCS team. The selection has been done. So they will be going to the villages and performing folk media, through which awareness will be generated amongst the villagers. And also, we are also going to have school outreach programs at the village level, and disseminating information on HIV and STIs at the village through ICE materials, and including the interpersonal communication sessions. All these things will be done at the village level by our field functionaries in coordination with the district administration and village council. And at the urban level, as mentioned earlier, we are going to have a rally. And then the state level rally is going to be organized on the 12th of August in commemorating the International Youth Day, as well as the day of the launch of intensified campaign. So this activity will be done, and all these things are being done to create awareness so that we can work together and disseminate as much as information to the people. And our main objective is to create as much as information and awareness within the span of 2 months. So we have this specific grievance line given to us, so that we get at least reach out to maximum people. And then we are also going to have flash mobs and some awareness sessions in colleges through RC. Because of this, preparations are going on from. We are starting from the Pokemon zone, and this Pokemon zone intervention will start from 12th and 13th. So the very purpose of training the RC delegates will be coming from 7 districts. So the very purpose of training these delegates is that they will be trained as HIV ambassadors, and when they go back from the youth convention, they will create awareness they will carry out awareness sessions in their respective colleges and institutes and wherever possible amongst their peer members. So this is the main objective of having this youth event, which will be from 12th to 13 August. So this is also included in our intensified campaign, which we are launching on 12th August. And then the other districts will be covered, the other two zones, Bilangpur and Walchuk, which will be paneled and conducted shortly. And the rest other districts will be covered on the first two zones. So we have different types of activities, and like our sir has mentioned, the special camps at government hospitals and desensitization and once again will be done. And we have, because of the social media influences that is present at the moment, we have social media activities extensively being carried out during this 2 months period, and we have shown in such a way that this will be carried out on daily basis for 8 weeks. And the themes that we are going to touch upon are route of transmission and prevention strategies, needs and misconceptions, risk perception and promotion of services, promotion of national toll-free helpline 1097, but not promotion of safe sexual behaviors, STI prevention and treatment, substance use and drug abuse, stigma and discrimination. So we have 8 themes in thematic areas which will cover almost the entire country of the HIV, and we are going to run this informations through the social media platforms that we have, and we are also going to use the Red Warriors. These Red Warriors are our insights dedicated of HIV ambassadors. Only we have also trained during last time during the influences, not even the first survey. So these influences, we are going to use them. We are going to piggyback on their platforms, and we are going to create as much as awareness on all these things, so that it reaches out to the general population. So this is how we are going to carry forward. This is our plan of the intensified campaign for 2 months.